Hi, my name is Shyam Kurian. I'm a fourth-year medical student from the Mayo Clinic, and today I'll be presenting on the correlations between COVID-19 cases and Google Trends data in the United States, a state-by-state analysis. I would like to thank the other members of my lab, as well as the Health Sciences Research Department of the Mayo Clinic, for making this talk possible. There are no disclosures from any of the authors. As we all know, we've been battling the COVID-19 pandemic since January of 2020, and cases have exponentially risen in the United States and continue to rise today as we see a second wave. Accurate data on the COVID-19 case load has been difficult to report due to lack of testing, as well as an overload of the healthcare system in general. Our study aims to evaluate whether a digital surveillance model using Google Trends data is feasible and whether accurate predictions can be made regarding new cases as well as new hotspot locations. We collected total and daily new cases in each U.S. state from the Department of Health at Johns Hopkins, which is publicly available data from January to early April. And we also collected information regarding 10 keywords from Google Trends and performed a correlation analysis on them to see whether there was any significant correlation between cases and these Google Trend keywords. The keywords we searched included COVID-19 symptoms, coronavirus symptoms, a combination of sore throat, shortness of breath, fatigue, and cough, coronavirus testing center, loss of smell, Lysol, antibody, face mask, coronavirus vaccine, and COVID stimulus check. When looking at these keywords over time from January to April, we see a standardized value on the y-axis, and this is basically comparing how popular a keyword is to the other searches over time. And as we can see, generally the keywords increased in popularity into March and then dipped going into April, with some continuing to increase into April and beyond, such as Lysol and antibody. When looking at the overall United States correlation coefficients for the 10 keywords, we can see that there's a wide variety of strength of the correlation coefficients, ranging from 0.06 to 0.88. Antibody being that 0.88. When conducting a state-by-state analysis of overall correlation coefficient, the strongest keywords we came across were COVID symptoms, coronavirus testing center, loss of smell, and face mask. As you can see here, each of these keywords are broken down into a state-by-state basis and shown over a spectrum of correlation coefficients. With face mask, you can see here they're very dark across the states, meaning that all of the states had relatively strong correlation coefficients relating to that keyword and COVID cases. We then decided to look at the correlation coefficients preceding the first case in each state, and then looking forward after the first case had already appeared. So time zero here on the x-axis indicates the first case in each state. The red line is an overall look at the United States, and each gray line indicates every single state in the United States for every single keyword. We looked at 16 days prior to the first case and 16 days after the first case occurred and looked at the correlations for each keyword and COVID-19 cases. What was pretty interesting here is that the strongest correlation coefficients for quite a few of the keywords happened days and days before the first case ever even appeared, meaning that when we look retrospectively, looking at Google Trends keywords, it gives us a predictive value in looking at when the first case may appear, as these keywords peak in popularity prior to the first case. So what we took away from this is that the study demonstrates there's a feasibility in syndromic surveillance of internet search terms to monitor new infectious diseases such as COVID-19. We're not saying that this can potentially completely replace traditional systems of reporting COVID-19 cases or other infectious disease cases. However, there was a clear correlation that occurred prior to the first cases around the country and in each state, as we showed from the figure 3. So this information could certainly enable us to better prepare and plan in terms of our healthcare system. Thank you for your time.